Everybody good? Good? Okay. Great. Good afternoon, everyone. Today is Tuesday, May the 5th. I am Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. I'm here with my fellow commissioners, Vice Chair Ken Lawrence and Commissioner Joe Gale, Dr. Brenda Weiss, Administrator for our Office of Public Health, and Dr. Al Wong, our Regional EMS Director, and of course, Sarah. Thank you for translating. So today we have 44 new cases of COVID-19 in Montgomery County. 7 of these cases are from long-term care facilities. 2 of them are from the Montgomery County Correctional Facility. So this brings us to a total of 4,611 cases. These positive individuals are from 26 municipalities, none of which are reporting new cases. So this keeps us at 61 of 62 municipalities home to individuals with COVID-19. These individuals today range in age from 1-year-old to 96 years old. And as always, you can check our county map at www.montcopa.org/COVID-19 for the updated municipal maps. Today we have 19 females and 25 males. 1 is known to be hospitalized, 2 are at home in isolation, and 41 we do not have information on. Actually, that's not exactly correct. 2 of them are in the correctional facility, so really 39 we don't have information on. I am also very saddened to confirm today that 39 more Montgomery County residents have lost their lives to COVID-19. This brings us to a total of 353 confirmed positive deaths from COVID-19. Now let me clarify this number a little bit. As we have talked about, the information on deceased individuals does not necessarily come in a daily fashion. And in fact, these individuals, the 39, range in dates from April 11th to May the 4th. In fact, 16 of these deaths occurred in April. So as we've talked about, sometimes the testing is done after the person is deceased, and it can take a while to get the testing back. So I just wanted to make sure that people understood that from yesterday to today, 39 people didn't lose their lives. But over these last couple weeks, we have had those lives lost. 15 of those individuals passed away in a hospital, 23 were in a long-term care facility or their residence, and 1 we don't have information on. They ranged in age from 36 years old to 99 years old. And overall, we have had 192 females and 161 males who have lost their life to COVID-19. Our self-described racial breakdown: 12 are Asian, 2 are Asian Indian, 3 are Asian Korean, 33 African American or Black, 98 white, and 205 we do not have information on. In terms of probable deaths, and as a reminder, a probable death is someone whose death certificate has COVID-19 listed as the cause of death, but we do not have confirmation from a lab. Now, as I just illustrated, some of these individuals will eventually get confirmation with a lab test and they will move into the confirmed positive. But as of right now, we have 162 total probable deaths. Added to our 353 confirmed positive, we are looking at approximately 515 individuals who died or may have died from COVID-19 in Montgomery County, or I should say our Montgomery County residents. Our hospital beds continue to be fairly stable. We have still close to 400 individuals hospitalized with COVID-19 across our 9 hospitals here in the county. About 1/4 of them are requiring ICU care and are on a ventilator. So again, thanks to everyone who is doing their best to stay home and only make those essential trips. We have gone a long way here in protecting our hospitals and our first responders. Today's long-term care facility update, we remain at 90 facilities that are reporting positive cases of COVID-19 among their staff or residents. Now remember, these numbers are self-reported from the facilities. We are at 1,192 cases among residents, 501 among staff, for a total of 1,693. As a reminder, not all of these individuals are considered Montgomery County residents, but we do track these cases separately to help you understand the ongoing and serious challenges that are being faced in our long-term care facilities and other congregate care settings. So if we look at confirmed positive deaths of Montgomery County residents, 286 of our 353 confirmed positive deaths are associated with a long-term care facility. So that puts us at 81% of our total confirmed positive deaths are affiliated with a long-term care facility. We continue to do outreach. As of the end of the day yesterday, we have 8 teams, 8 field assessment and support teams known as FAST teams. These are 2 individuals form a team, and they are going out and visiting our highest priority facilities. As of the end of day yesterday, they have made 47 visits. They've visited 47 facilities. They are offering guidance on infection control policies, appropriate use of personal protective equipment, and helping to ensure that the facility has enough PPE. They are recommending testing for the virus among all of the residents and staff so that facilities can get a better handle on the situation in their particular facility. And then there's a debrief that occurs after the visits, and we are sending guidance to these facilities to help connect them to testing and any other resources that they might need. I remind you that these facilities are licensed by the Pennsylvania Department of Health. It's the PADOH that is responsible for the licensing and regulatory oversight of these facilities. We are doing this really to help out. Because we know that these facilities are facing some serious challenges, and we want to do everything that we can for our residents here in Montgomery County. Today's update from the correctional facility, it continues to be stable. All inmates, the 171 who tested positive and were asymptomatic, as of this morning remain asymptomatic and in isolation. I mentioned earlier that we had 2 new positive individuals at the correctional facility. Both of these individuals were transferred from another county's correctional facility to our facility, were tested and tested positive. Both of these individuals are in isolation. To give you an update on the overall situation at the correctional facility, since President Judge Del Ricci issued the initial March 12, 2020 order declaring a judicial emergency, the population at Montgomery County Correctional Facility has gone from 1,342 to 923 today, which is a net decrease of 419. That represents a 31% decrease in the population. Since March 12th, there have been a total of 728 discharges. The average number of daily commits is now 2 to 3 per day, compared with 28 per day before March 12th. And the total number of commits is 319. So total number of discharges is 728. Total number of commits is 319 since March the 12th. All continues to go well at our community testing sites. The Norristown Walk-Up Community Testing Site is open every day this week, Monday through Friday. We want to thank all the team at the Delaware Valley Community Health Center, Dr. Julia DeJoseph, VP and Chief Medical Director, and Scott McNeil, the President and CEO. Appointments for the Norristown Walk-Up site, which is for Norristown residents only, will open tomorrow morning at 8:30 a.m. by calling 610-592-0680. That's 610-592-0680 for Norristown residents only. The clinic runs from 11 to 1, and they will just be doing testing. There is no treatment occurring at this site. The Montgomery County Community College site is also open and running smoothly today. And again, we want to thank the Community College, Whitpain Township, and the Police Department in Whitpain, and the National Guard, who's been with us now for quite a while, and several county departments that are assisting with that testing. As of May the 2nd, so looking at the period from April 16th, when we opened at the community college, to May the 2nd, we've now tested 3,514 individuals between the drive-through site and the site in Norristown. We have received results on 3,203 individuals, which represents 91% of the total. 483 of these individuals who are positive. So for these first 15 days, we are now running an average of 14% positive. So those of you who've been paying close attention, we are down 8%. So we are happy about that. The appointments for tomorrow, Wednesday, will open at 8 a.m. Wednesday morning. Appointments can be made at montcopa.org/COVID-19 under the green County Testing Information button. Or you can call 610-631-3000. We prefer you to make an appointment online if you're able, but if you don't have good internet or an email address, you're welcome to call 610-631-3000. Just for those who like to plan ahead, the site will be open on Saturday, but will be closed on Sunday for a safety stand down, which also includes Mother's Day. So for those of you who need to do your Mother's Day shopping, this is your alert for Sunday. Make sure you do your shopping from your home, not out at a store unless absolutely necessary. Okay, so today's graph. As we've been discussing, we've been doing our best to break out some of the different types of cases here in the county and also present you with a 14-day average of our case numbers, which would put us in, give us some sense of where we are compared to Governor Wolf's numbers for relaxing some of the guidelines currently in place on our stay-at-home order, which still is in place. So to walk you through this chart, the gray bars are the daily positive cases. So those are our confirmed positive cases as they come into us each day. The yellow line is the total 14-day average of our total positive cases. So that's just our running 14-day average. And by the way, this chart goes through April the 30th. So the last couple of days are not in there. Now, the blue and the orange lines are our attempt to separate. The blue is the community, the orange are the long-term care facilities. So actually the blue is everything except a long-term care facility. Now, I want to be very clear that these orange line is not 100% accurate. We're still working on that line. The reason is that the long-term care facilities, particularly some of the ones that are affiliated with a hospital, when their testing goes in, they might just put the hospital address or the hospital zip code. Sometimes we have to actually tease apart where that particular individual resides. So this is not precise to the absolute individual, but it's close. We may be off by a few. The important thing, though, is these trends. So in all cases, these trends are going in the right direction. We can see that these curves are starting to come down. As is no surprise to us when we saw these numbers, the blue, which is everyone in the community except for long-term care residents, we felt that peak a while ago. In fact, we talked about how at our testing site we had peak positivity days on April 5th and 6th. So you can see where that curve starts to flatten out and how we've done a pretty good job of keeping it flat, and now it's actually starting to come down. Similarly, we saw around April 21st this big increase in numbers from our long-term care facilities. And it was about that time, we've been worried about it for a couple of days, that we started to put together these FAST teams, these teams that are actually going out and visiting these facilities. Now they visited 47. And it was out of concern when we saw those growing numbers that were peaking around April the 21st that we started to put those teams together. So you can get a sense of how we're doing, and hopefully that will help answer people's questions on what's happening in the long-term care facilities separately from what's happening community-wide. But the good news is, in all cases, we are moving in the right directions. So with that, I will turn over to Commissioner Ken Lawrence.
Good afternoon. Today I'm going to speak about Giving Tuesday. Giving Tuesday usually happens on the Tuesday after Thanksgiving, but today, May 5th, the global charity has added a second date as an emergency response to the unprecedented need caused by the COVID-19 pandemic. Across our communities, the COVID-19 pandemic has demonstrated neighbors helping neighbors. People and organizations are sewing masks, donating PPE and food to rally around the tremendous need the crisis has spurred. We are encouraging our community today to take action on behalf of first responders and frontline workers, the nonprofits and community organizations that feed, house, educate, and nurture our neighbors impacted by the global pandemic. So if you have a favorite charity, please consider making a donation to them today. Or if you don't, please consider a donation to the Montco, PA COVID-19 Response Fund. This is a community-wide effort to support safety net organizations supporting the immediate needs of residents hardest hit by the pandemic. Grants of up to $5,000 are being reviewed and processed on a rolling basis to safety net organizations. Projects are prioritized based on the geography they serve, the capacity to meet the higher demand for services, and whether the project targets particularly vulnerable populations. Grantees so far include food pantries, senior care programs, rent and utility payment programs for low-income residents, behavioral health care and telehealth services, ambulance services, child care for healthcare workers, domestic violence services, PPE purchases for nonprofits, continuing essential in-person services, navigator support, and emergency shelters. More funds are urgently needed to support the ongoing efforts of our first responders and social safety net providers. And there's also two creative ways you can support the fund. If you're a runner who's had your race canceled in May, Destination Conshohocken has started a virtual race series to benefit the fund. Participants have the opportunity to run the race distance of their choosing and donate that distance as miles. For example, registration for a 5K would cost $3.10, and that would go directly to the fund. And you can sign up at runsignup.com/race/PA/Conshohocken/miles for Montco. And we will have this on our hub as well. And it's been a week or so since I channeled my inner QVC host and showed our Montco Strong t-shirt, which is a partnership between the Valley Forge Tourism and Convention Board and DJB Specialties. The cost of the shirt is $25, and all proceeds benefit the Montco, PA COVID-19 Fund. And information on purchasing a shirt is available on our hub as well. And with that, I'll turn it over to Commissioner Joe Gale.
Hello everyone, I'm Montgomery County Commissioner Joe Gale. Today I'd like to share with you a recent update from the Pennsylvania Department of Transportation. PennDOT announced today that the expiration dates for driver's licenses, identification cards, and learner's permits will be extended for Pennsylvania residents in response to the statewide COVID-19 mitigation efforts. Expiration dates for driver's license, photo ID cards, and learner's permits scheduled to expire from March 16, 2020 through May 31, 2020 are now extended through June 30, 2020. All driver license centers and photo license centers have been closed since March 16th. However, driver and vehicle online services are available 24 hours a day, 7 days a week at dmv.pa.gov. Through this webpage, Pennsylvanians have the ability to renew their driver's license, renew their photo ID, and also their vehicle registration. They can also submit changes of address, pay driver's license or vehicle insurance restoration fees, and schedule their driver's exam. There are no additional fees for using online services. Again, that website is dmv.pa.gov. As more extension dates become available, I will keep you updated. Thank you, and with that, I'll turn it back to Commissioner Arkush.
Okay, questions?
We've talked a lot about long-term care facilities, but you said from the start with the red, yellow, green that came out from the governor's office that was kind of a big picture. You know, we tended to focus in on the average cases per day, and you said that's a metric, but it's just part of the big picture. The other things you mentioned, PPE, hospital beds, those kind of things. How's Montgomery County looking at when you look at the
So the question is sort of big picture, how are we looking in terms of moving from red to yellow, I guess is really your question. That, these numbers are one piece of the governor's plan, but how are we doing on other metrics? I can really only speak to Montgomery County. I don't have all the details of the entire Southeast at my fingertips, but we're doing okay. I think that, as we talked about last week, because of pretty good adherence to social distancing here in Montgomery County, our hospitals are stable. They are currently able to accommodate the number of patients that have been coming in. They are still very short on personal protective equipment. I think that's going to remain a concern in our hospitals for a while. And they have enough, but they're still using it in ways that we would not normally use it under more normal circumstances. So PPE remains a need. Testing, particularly rapid testing that would give you a result in 10 to 15 minutes, is an enormous need, mainly because that will help our businesses open more safely. The more people that we can test right before they're ready to go back to work or go back to school or go to camp, whatever the scenario, the more safely we can do that. It's not absolutely necessary, but it would certainly be the safest strategy if we had more rapid testing available. Right now, we really don't have any. So, from those metrics, we're making decent progress. I'm very encouraged to see that our case numbers are clearly trending downward. I do want to remind everybody, though, that this is not a license to be free. We can easily turn this around, and we've talked about how just one person who's walking around who's contagious but asymptomatic and doesn't realize they're contagious, how one person can impact literally over time, over 100 people. So we just want to encourage everybody to continue to do what you're doing. We are moving in the right direction. We have, I believe, turned the corner. And this is a good time to really start thinking about what are you going to do differently when we go from red to yellow. What can you personally do to be part of the solution to make sure that you are safe when you go out into the community, that if you run a business, that it is as safe as possible. If you're an employee at a business, what can you do to help make that business safe and accessible for people? So this is the time to be making plans.
And if you could explain that, turn the corner, that's very optimistic, and I know that was kind of part of the answer, but just to kind of pick that out, when you say turn the corner, how much optimism should we read into that?
So the question is, I say we've turned the corner, how much optimism should we read into that? If people continue to practice social distancing and to stay home, then you can have some optimism. As you can see, we are clearly starting to come down, and perhaps just as importantly, we stabilized at a level for several days, which is great, and now we're actually starting to come down. I've been saying for days I want to see these numbers start to come down. We're finally starting to see them come down. And if this holds, then we're on our way down. But it's fragile. I just want to remind everybody that it's fragile and very, very easy to send these numbers going the other way. So what we have to keep in mind is we want to keep these numbers coming down so that when some of the restrictions are relaxed and we inevitably get a little surge, a little increase, which we will, that our hospitals are going to be in good enough shape to take that. They're going to have their supplies replenished, that we'll have enough testing to test everybody that needs to be tested, that our first responders are in good shape and they have the equipment that they need. So it's all woven together. But I believe that there is reason for some optimism if people keep doing what they're doing.
So with that in mind, then, people may hear this and say, oh, well, there's optimism. That means we should start lifting some of these restrictions now. Are we at that point yet, or is that?
We are not at that point. We are still, just to give you a sense, actually. So we've talked about the governor's, one of the governor's metrics is getting us down to 50 per 100,000 cases. Coincidentally, that's where that orange line is. which is where the long-term care facilities are now. That is not indicative of the whole population, obviously. But just to give you a sense, that's the point on the graph that is about 50 per 100,000 cases, where the end of that orange line is. So we've got a little ways to go here, but we're going in the right direction. So if people continue to do what they're doing, that'll get our cases down. It will continue to get our cases down. And when it's time to relax some of these restrictions, I think we'll be ready to relax them.
Any concern over this nice weekend that we had and people were out everywhere that we're going to see lengthy cases in the next?
So the question is, you know, it was a nice weekend and there were a lot of people out. I actually went for a long bike ride on the Schuylkill River Trail Saturday morning, and it was actually pretty good. I think maybe later in the day I heard it got a little bit more crowded, but most people had masks on, or if they weren't wearing them continuously, they were pulling them up as they were passing other people. Like, I actually was pretty encouraged. But we really have to be personally responsible. I just can't stress this enough. There are people who, because of medical issues, particularly respiratory problems, really find it difficult to wear masks. They find it almost impossible to breathe if they have a mask on. So everyone that you see that doesn't have a mask on isn't necessarily doing that out of some sort of, disbelief in how serious this is. Some of them may not really be able to wear a mask, which means the rest of us have to do our part. We have to be personally responsible and do everything that we can do to protect other people from us. Because any one of us could be that asymptomatic person who's actually positive and is walking around spreading this virus. We don't know who you are because we don't have the ability to do widespread testing. So we have to all walk around under the assumption that maybe we're positive and behave accordingly. And if everybody does that, if everybody follows the rules in the stores, take your business to the stores that are really complying. I've seen extraordinarily good measures in many of our county stores. Go to those places and follow the rules. I think we'll be okay. At some point, we are going to have to be able to live with this virus and relax these guidelines. And this is how we're going to have to do it. Every single person has to be responsible for their behavior and not screw this up for everybody else.
The governor said today that when it comes to reopening the area, that no decision has been made on his level about whether or not the long-term care and nursing care facility numbers will actually factor in, because it is such a disproportionate number for such a big area of the state. So he was asked that a couple of times today. Have you had conversations with him about this? And it appears as though you have a strong opinion on whether or not these numbers should be included as to when we reopen.
Yeah. I have not actually spoken to the governor directly about this, but I feel strongly that we should not forget that these are human beings in our long-term care facilities, grandmothers and parents and aunts and uncles and brothers and sisters, and that, again, it's on all of us to do everything we can to support these long-term care facilities. They have a really, really tough job on their hands for a lot of different reasons. And remember that these individuals, some of them, will go to the hospital. People are in these facilities for many, many different reasons. And so it's not correct to think that these individuals are on an island and have no impact on our entire community. They do. And the people that work there every day go home to their families in our community every night. So I do think it's important for everyone to understand the fraction of our total cases that this group represents. It's not as much as I think a lot of people think, which is what we wanted to try to illustrate today. And it may be, part of why we're looking at this is we were curious to see if we would see different rates of decline in the numbers in long-term care facilities. I think it's a little too early to answer that question, but it's possible that we might, and it's possible that those lines could be considered separately, but I don't know that yet. I don't know that we have enough data to say that with certainty, but they certainly have to be considered.
There's been a social media thread of it's the long-term care facility's fault. Do you have an opinion or thoughts on that? That these
there's the answer. The question is, or there was a comment that there's a social media thread that this is all the long-term care facility's fault. I don't see that in these numbers. It's actually the orange line, which is long-term care facilities, is a much smaller fraction of our cases. The community cases are above it. It's not the other way around. So if this in no way lets the community off the hook. Everyone who's out there shopping and thinking it's fine for them to be out there shopping because this isn't their problem, this is some facility's problem, the numbers are the truth. And the numbers show that the community numbers are much bigger than the long-term care numbers. So again, this is back to everybody has to be personally responsible here. Everybody has to assume they might be the one spreading the disease and behave accordingly. That's how we get this over with. That's how we get done with this, and that's how we learn to live with this, because this is going to be with us for the foreseeable future till we have a vaccine. If we want our kids to be able to go to school this fall, we want our businesses to be open this summer, everybody has to be part of the solution. Everybody.
Some of the local hospitals say they are seeing patients coming in that are asymptomatic, that are coming in being treated for a stroke, blood clots, and then it's afterwards that they're tested. Are you aware of any of the cases they're talking about, or any of them being fatalities, where a person comes in, doesn't have any of the stuff we've been told to look for, but is being treated for stroke or blood clots or something like that, and then turns out later to be tested?
Yeah. So the question is, am I aware of any cases where people have come in with other symptoms like a stroke, heart attack, a blood clot, and sometimes even passed away, and then was subsequently tested and found to be COVID positive. So I'm not personally aware, and I don't actually get that level of data in our reporting, but I'm still reading the medical literature almost every day, and absolutely that is correct. This is the strangest virus that I think any of us have ever seen. I've never in my medical career seen anything like this, where it can present in so many different ways. So there was sort of our classic presentation, right, of fever, dry cough, difficulty breathing. Now we know that people are coming in with complications from their blood clotting, like strokes, heart attacks, and pulmonary, what's called a pulmonary embolism, where a blood clot goes into your lungs. We are seeing rashes. We are seeing, but mostly those rashes are caused from small, very, very small blood clots, like showers of them. We've seen, problems with people's toes. We've seen this issue with losing smell. It's extraordinary how this virus can present in so many different ways. So again, I just remind everyone we've only known about this since middle of January, but this is a really, really unique situation. I can't think of anything else medically that has had this highly variable presentation. And of course that makes it all the harder to figure out what's really going on here. So it's going to be a challenge for a while. I think we really have to hope that a vaccine is found that works. This is a mighty foe.
Sorry about that. With what you just said in mind, is your health department still reaching out to everyone who tests positive? And are there conversations about their symptoms or their challenges?
No. So the question is the health department still reaching out to people that were positive? No. We stopped sort of that contact tracing, it seems like 5 lifetimes ago. I don't know how many weeks it was ago, but at least 6 maybe, something like that, weeks ago. Our hope, though, is, and we are working to build a much bigger contact tracing team, that once our numbers get down a little bit lower, that we will start that contact tracing again. That will be a critical component of opening back up, particularly in the absence of rapid testing, which I continue to hold out hope for, but I don't think we're going to have. Doing that contact tracing will be very helpful, because that's going to be our best way to say to people, you've been exposed, and depending upon what your job is, et cetera, you may need to quarantine. So that will start again at some point, but we're not quite there yet. Anything? No? Anything from outside? No? All right, we'll see you tomorrow. Thank you.